Well, there we are. It's 12 noon. Hello, everybody. Lovely to see you. Welcome to the Institute of Health and Social Care Management's Workforce Wellbeing Special Interest Group meeting. This is our November meeting, and I'm thrilled, actually. We're going to start today with Meike Madelung just in a moment or two. But I just want to say to those of you who were part of our Workforce Wellbeing Festival yesterday, thank you for coming along. Do hope you enjoyed it. And thank you to all of the participants, particularly in the presentations, including Meike's colleague, which was fantastic. But without further ado, it's probably smart now if I just shut up and hand straight over to Meike. Meike, you're going to talk Firestorm to Burnout, the impact of the pandemic on healthcare professionals. Looking forward to this. The floor is yours. Thank you.
Thank you very much. Thank you for having me. Thank you to everyone in the audience for spending your lunch period with us. Yes, maybe a very quick word about myself. My name is Meike Madelung. I'm an engagement manager with the IQVIA EMEA Thought Leadership team. And what we do is we work on all sorts of issues that concern not only the pharma industry, but healthcare systems in general. And one of the things that we've done is actually we've spoken to healthcare professionals across 6 countries on what their current status is in terms of fallout from the pandemic. And so basically, I'm going to dive right in. We all know that healthcare workers have been under considerable stress for quite a while now, and we also know that people are leaving the profession for this reason. And that's not something that's just limited to the UK. Other countries are also dealing with this. There are demographic trends in the background, aging populations, more patients, at the same time, fewer healthcare workers. And we also know that budgetary issues have been a topic for healthcare systems for a while now. And at the same time, we're getting innovative therapies that are much more demanding. So they have excellent results, but they are very demanding for the healthcare system. And then, of course, the pandemic didn't do anyone any favors. I mean, we know that healthcare professionals during the pandemic were absolutely outstanding. But they also suffer from the aftermath. And we know that people are even leaving the profession after the pandemic due to burnout. But we also wanted to know what the current situation is. And that's why we spoke to healthcare professionals across 6 countries. So this survey was limited to physicians, although I think a lot of the answers can be extended to healthcare workers in general. And we were looking at physicians in 6 countries. That's the US, the UK, and the EU top 4. So that's Germany, Italy, Spain, and France. And we asked them a number of questions, considering what their current working situation is, what the main stress factors is that impact their well-being, and also what kind of support they are currently getting and what kind of support they would be looking for and whom they would be looking this for from. Oh, got quite a sentence in there. And I think the latter part is probably particularly interesting. So we've looked at this and we've broken this down by country, and I think it's also interesting to just have a look at so what do countries have in common and where do they differ? Where do things differentiate? So basically, I'm going to talk you through the top results of the survey, and then I believe we can have some discussion time at the end. And if we're looking at the sample, that was quite evenly spread out, 120 physicians per country, around a third with general practitioners, and then we have some specialties. And this is also a mix between hospital-based and office-based physicians, and that's basically the reason for that is the different structure of healthcare systems in the different countries. And what's not really surprising is that a considerable share of doctors do report an increase in patient caseload versus the situation pre-COVID-19. We do know that there is still a considerable patient backlog. Patients didn't see their physicians as often as they used to during the pandemic, and that has built up a backlog, and we know that's still not quite resolved. What is noticeable is that the share of physicians in the NHS is far higher than the average. So for the NHS, 72% of doctors in the NHS reported this increase. Now we can't quantify this increase, but that generally suggests that the NHS in a way has been hit worse by the fallout. I mean, we all know the official NHS statistics when it comes to waiting times for treatments in hospitals and so on. I mean, the NHS does have outstanding statistics, by the way. It's always very easy to find things out where we stand there. And the obvious question, of course, is why? Where do these backlogs come from? And it's not entirely surprising, clear and patient backlogs is really in the lead here. Pretty much across all countries, again, with the UK in the lead. What's also interesting is that introduction of new ways to manage patients remotely is a strong second in many countries. Especially in Spain, which had a strong drive towards digitalization during the pandemic, and we can see that here. In the UK, it's also a topic, vaccination and others are not really that big a factor here. So it's mostly patient backlogs and remote patient management. And the other thing, of course, is if we know that we're still dealing with a pandemic fallout, that also means that the non-COVID health services aren't quite operating the way they used to. There's still an impact there. We're still feeling the impact. And the question really is, what are the main factors that drive this particular impact? And in the UK, really, it's a double whammy. We're seeing that understaffing due to resignation and burnout at 74%. And that's again higher than the average reported by across these 6 countries. And patient backlogs, again, much higher than the average, are a leading reason, and essentially undertreatment of conditions due to lockdowns, and that's closely related to the patient backlog problem. Essentially, patients couldn't be seen, patients were afraid to go to doctors, so all of that, we're still seeing that, but we're also seeing that this is reported at a much higher level in the UK, and obviously it's on the one hand, we have fewer healthcare workers. On the other, we have higher demand. And it's not surprising that healthcare workers are under considerable levels of stress, and they do report this stress. If we're asking what is stressing them, then again, the logical consequence really, workforce shortage, and that results in a severe lack of work-life balance. And the increased workload. And the other thing that's also insufficient compensation is a considerable factor, but not the highest by far. And I think the other thing that's really concerning is how many are reporting an uncomfortable work environment. Because on top of everything else, having an environment that isn't conducive to well-being is neither good for healthcare workers nor for patients. And that's the other thing that they're saying, is that really all of this affects their ability to care for their patients. And again, the country breakdown, and we are seeing that these are major issues in other countries as well. Workforce shortage is being reported pretty much across the board. It's a major problem in Germany. It's an issue in the US. So yeah, it's not just the NHS that's suffering from that. That's a global problem. And compensation is also a significant factor elsewhere. But then again, we're looking at the increased workload and patient backlogs again being reported by more than, well, by 70%, but that's high in Italy and in Spain as well, for instance. And in a way, the workforce problem is a fundamental one. I mean, that's becoming a systemic problem because people are leaving the profession for various reasons. And the WHO reports that for Europe, more healthcare workers are leaving the profession than entering it. And that's in part may be due to how attractive the profession is, but there are also demographic factors at play. So long term, we will have to think very, very hard about what we can do to make those people who are in the profession stay there, and enable them to do their job efficiently. So that those who remain in the profession can actually look after patients to the level that's needed. And of course, none of the healthcare systems are going to like this. These are issues that also can be remedied with money, and we also know healthcare budgets are short. So the question is, what do healthcare workers expect in terms of support, and where do they look to? And it's really quite obvious that far and away, healthcare workers expect government and policy takers to take over, take on the responsibility, and provide the support that they need, not just to stress, that was the question, to address and ease the burden of COVID-19, but generally to ease the stresses that the healthcare systems are under. And what I find quite interesting, if we're looking at the country breakdown, then I think we're seeing quite a bit of convergence among the European healthcare systems, where really most healthcare professionals look to the government and to policymakers to provide support, to provide the enablement that healthcare systems need. And second in line is looking to other healthcare professionals as well. In the US, it's only 28% that are looking to government and policymakers, but 36% that expect this kind of support from their employers. And I think this speaks to the very, very different structure of the US healthcare system compared to the European healthcare systems, which are obviously largely centralized, and where government does play a very strong role in both in funding and in determining policy. So yes, the US is a bit of a standout here. And if we're looking at the support that healthcare professionals are getting and the report they expect, then there is, and that's hardly surprising, a significant gap. So if we're looking at the biggest factor where support is expected, and that would be invest in the health workforce by increasing staff and improving working conditions. 66% of healthcare professionals expect this kind of support, or say they need this kind of support, but only 35% are getting it. And similar gaps we see when it comes to improve workforce planning and recruitment and training of workforce. And these are really the leading causes. The other thing that's being asked for is investment in primary and community care or expansion of home care. And we also know that primary care is suffering from underfunding. A lot has gone into secondary care. And the systems are feeling the crunch, and the healthcare workers are feeling the crunch. So they are asking very much for investment here. And again, only 33% are getting it. And what's worth bearing in mind with these questions, of course, we cannot actually see the extent of the gap. So if healthcare workers are saying, well, we're seeing some investment here, it doesn't really tell us, are we seeing a lot or just a little? So we can't quantify this at this point, but what we're seeing is the gap. And for this one, I'm focusing on the expected support for the country breakdown. And here we're also seeing actually a very similar picture across all European countries. Across all European countries, 2/3 of healthcare workers are asking for investment in the health workforce, with more staff and with better working conditions. And I know this hardly comes as a surprise, because we all know there have been massive strikes in the NHS. There have been some strike action in Germany. There even has been some strike action in the US. So it's not really surprising, but I think it's interesting to see this in numbers and to see that we're actually seeing very much the same demand and the same need across all European healthcare systems. And similarly, also recruitment and training of workforce. So essentially, these are related topics. And a bit more divergence when it comes to the investment in primary and community care or the expansion of home care. That's where we're seeing more demand in Italy and Spain. And somewhat less in the other 3 European countries, and a good deal less in the US. And again, the question here, of course, is does that mean that those countries where there's less need being expressed either are structured in a way that they don't feel it's really necessary, or maybe they just are ahead of the game there and actually are doing better? And but that's not really something we can quantify here. And since government is the stakeholder in the healthcare system that most healthcare professionals look to for support, I think it's also worth having a closer look at what exactly are they asking government and policymakers to do. And here, clear in the lead is better compensation, more money. And again, programs to ease the burden of healthcare providers, such as more support staff and better reimbursement policies for innovative products. And with a focus on products which can reduce the time spent by healthcare professionals on patient care. So investment in efficiency gains essentially is what's being asked here. So these are really the top 3 expectations that we're seeing here from government. And of course, that's where the crunch is really, because on the other hand, we're seeing, and IQVIA looks at this quite a bit, that of course, healthcare systems and healthcare budgets are actually being, well, there's not a lot of increase there. And if anything, budgets are being squeezed. So there is certainly a conflict there. But there's some light at the end of the tunnel. We also did ask physicians what they think when the pressure due to the COVID-19 and the post-COVID-19 environment might finally ease or resolve. And while few people are optimistic for the short term, that is to say the next 6 months, and it's a little surprising that Germany is outstanding here. We're not known for our exuberance when it comes to that sort of thing. But at least within the next 1 to 5 years, over half of physicians expect that things will get better. So that at least there is some expectation of improvement there. And if you add the next 6 months and next 1 to 5 years up, then we're in the 60% range, in parts higher. So at least there's that, people do remain hopeful that we are seeing light at the end of the tunnel. And that's more or less bringing me to the end of what I've prepared for today. So the summary really is that a large majority of UK physicians did report increase in patient caseloads, and that this is driven largely by the unresolved patient backlogs from the pandemic. We're also seeing that both these backlogs and the lack of staff are the primary factors impacting health services outside of COVID-19. And also that uncomfortable working environment. And that covers quite a bit, really. Uncomfortable working environment that includes aggravation from patients, that includes issues like management of facilities, so quite a range there, but that these are also, that's a very large contributor to stresses, and probably also something that healthcare employers could look at in order to improve things, to improve well-being for their workforce. And although results from other countries are similar, we do see that respondents report, UK respondents report back higher levels of these problems. But when we're looking at support received and expected, then we're seeing that NHS doctors are really very much aligned with their colleagues from other countries. The US is a bit outside of that scope, but certainly across Europe, we're seeing very similar experience and expectations in terms of support. And these are mainly directed towards government and policymakers, and they center on investment in the workforce in the widest sense. And by the way, I did include a link at the bottom. So if you're interested, the entire white paper is available for download. There is also a lot of other material there that we're happy to make available to people. So if you navigate to that site, you'll find a lot of other, I find, extremely interesting material, but certainly the full white paper based on this survey. So yes, that's pretty much what I had prepared, and I think we can open the floor to discussion.
Thank you, Meike. That was very thorough. Goodness me. As one would expect of IQVIA, to be fair. But good stuff. Thank you. I suppose just while people think if they want to have any questions and so on, I mean, the difficult truth is that all of the factors that your survey points to are things that the individuals concerned cannot really do anything about, which, you know, and I'm worried therefore that this well-being or lack of it is something that will continue for a considerable period of time. I mean, you know, the individual can't really do anything about a workforce shortage. The individual can't really do anything about their place of work environment. You know, these are the individual can't really do any much about the wait list. So I understand the nature of the report, but it kind of leaves me feeling a little bit hopeless in respect of, so what can we do about it?
Yeah.
Well, let's see. I didn't really expect a response from you there, but that's where we got to. Would anybody like to ask Meike a question, I wonder, at all? Just unmute and go for it. We're all listening in. All right.
Khalil has their mic on. I think Khalil has a question.
Go ahead.
No, I'm sorry. No.
Okay.
All right, don't worry, that's fine.
Yeah.
Well, look, shall we say thank you to you, Meike? In that case, with these slides are available to us, is that right? Certainly the white paper is available.
The white paper is available, and yes, I'll be happy to share the slides.
Could you do us a favor and pop the white paper download link in the chat?
Of course, I'll do that straight away. Yes. Maybe just one brief sentence to what you're saying. Yes, it's true that a lot of these things that the healthcare professionals are reporting are in a way outside of their immediate area of impact. I think it's still useful to actually have that voice, because we do have statistics where we have vacancy statistics from the NHS, we have them from the German healthcare system, and we do have figures, but I think that voice is still important. But the demand and the question is really being addressed towards essentially people who run the healthcare system. And yes, that is certainly a factor here, yes.
Right, thank you very much, Meike. We really appreciate you coming on all the way from Frankfurt today. You'll be having your Christmas markets opening soon, I should think, if they're not already open.
Yeah, I think towards the end of the month. Yes.
Excellent.
Yeah.
I'll go and have a Glühwein on us, won't you?
I will do that, yes.
And perhaps a bit of pork knuckle, you know, why not? There we are. Thank you
Yes.
very much indeed. Okay, well, look, we'll open the meeting now to the main group. If you could just stop sharing for me, Meike, that would be very helpful. Thank you.
Yes,
that's all right.
I'm stopping sharing now, right? I'll just share the link to the download, and then
just pop it in the chat for us.
Exactly, and then I'll leave the call.
Thank you very much. Lovely to see you. Thank you. Okay, folks. Look, I think it's important that we take on board what Meike has said. Obviously, that chimes in with quite a lot of the activity that we had yesterday within the Wellbeing Festival as well. What we really want to use today's event for is I'd really like us to re-look at the Wellbeing guide that we created back in 2020, I think, end of 2021 was it? Forgive me. And how we can really readjust that, because it's a fab document. I just think that we kind of need. Have you all seen this document from back then in 2021? Did any of you contribute to it? It's something that the Institute did back in 2021. We decided that the NHS back then was in such a parlous state that we really ought to create a workforce wellbeing guide, looking at good things that you were all doing all around the country, those of you involved in health and social care management, and most importantly of all, how that could advance a sense of well-being in the people that you lead. Jade has just put the guide up in the chat, if any of you would like to have a look at that now whilst we go around. What we would like to do is republish that, but obviously there's quite a lot has happened in the last couple of years, so we'd like to bring in some new ideas, new techniques, new things that people have done, many of you may have done, or you may have experienced, that have boosted your well-being. We're not wildly interested in going over all the problems. They are well documented, and this is not that kind of a document. This is about, if people are interested in how to boost their organizational well-being or their own well-being, here are some tips and techniques tried and tested by our members for our members, and we just kind of bring it together in one group. Does that make sense? And if you remember, it was everything. It was kind of things like, what do they call the mugs? You've been mugged. So it was just like a mug that you would fill with confectionery and nice things, and just put that on somebody's desk and say you've been mugged because you've done kind of good stuff or whatever it might be. Your job when you'd emptied the mug was to refill it and go and mug somebody else. Do you get the idea? It's this kind of very gentle stuff, but it was rather nice, I think. So would any of you like to contribute to that? Do you see what we're trying to do? And we will then republish this wellbeing guide to bring all of the rest of our members up to speed in terms of, here's some cool things that have been done. What do we think, folks? We all on board with this as an idea?
Absolutely, 100%, John. So hi, I'm James, for those who don't know me.
Hello, James.
Yeah, so I did contribute on behalf of TAP, the social media platform, last time around. I'm sort of just still thinking about your sobering reflection on that very insightful presentation around there's not an awful lot people can do around workforce shortages and patient sort of queues and all the rest of it. But I guess what's great about this kind of document is it's actionable. It's small things that make a big difference, and it's things that people can take control of, because they can't control some of the bigger things, but they control some of the smaller things on a day-to-day basis. And that's what I like about this. It's the small stuff, James. It's the small stuff that makes a big impact, rather than the big stuff that gets, that squeezes your world and makes you feel depressed and anxious.
Perfectly put. Thank you, James, and we appreciated your support last time as well. Thank you.
And just as I've got a little bit of a stage, Simon is my colleague today. Simon was actually at the festival yesterday. So Simon Gamer's our content producer. And what I was going to say is that Simon has been a breath of fresh air to TAP over the last 18 months or 2 years. He's produced so much content, wellbeing content, blogs, podcasts, videos. All that stuff is a resource that we'd be very happy to make available to IHSCM members through our free to download app, or even through our website. So these are things that we would certainly bring to play if you're happy. Perfect.
That's very generous, James. Thank you. And Simon, I hope you enjoyed the desktop yoga exercises yesterday, and you're not feeling too stiff today.
Not at all. I used to do a lot of yoga before I broke my back, and so it was nice doing some box breathing and stuff as well.
There you go. There you go. I enjoyed it as well. All right. So can you all see? I don't know whether you've seen. Shall I share my screen? Would that be helpful? If I may, just in case any of you have not seen it, this was the document. A rather nice photograph. If you're wondering where this is Southern Down Beach in South Wales. This is near Ogmore by Sea, in between Ogmore by Sea and Llantwit Major, that kind of area. A beautiful sunset photo. And this was December 2020 when it was first published. So yeah, 3 years, a lot can happen there. You can see what we did is we broke it down into, I think, 9 different sectors, from places through to mental first aid, self-care and resilience. You can read all this yourself. I don't need to go through it. So if any of you have got stuff that you would like to kind of link us to, contribute to, you can see we just feature all of it. Doesn't matter, big, small, really doesn't matter. It's all in there. And the idea is we'll keep that. We'll keep all that we had last time, because its motive is still perfectly sensible. There's the mug thing, Newcastle hospitals with their mugged idea. But if you've got your own ideas, we'll feature it. And perhaps most importantly of all, we list out everybody at the end there. So you'll get a name check, you'll get a mention. You can see the sorts of people that contributed last time, including James's Thank and Praise organization. Yeah, we've got a really good contribution network from that. Is that all right? I'm going to stop sharing now. So just help me feel reassured here. Just put your virtual hand up if you think you've got something that you'd be able to contribute. I'm just keeping a good lookout here. Good, thank you, Marie. Inga's got something, Kanita's got something. There we are. I think some of us may not be entirely confident about using that. Okay, are we all happy there then? We all think that's a good idea? Happy to do it? All right, excellent. So we'll wait. If you could send them to Jade or myself, your ideas, that would be absolutely marvelous. The idea is we'll get on and publish that probably in January now, but really have a proper bash at this well-being idea again. See if we can re-oxygenate it to be a topic of conversation around health and social care in the new year, and we'll go from there. Is that all right? What did you think of yesterday's event? Those of you that were on it.
Really enjoyed it. Thought it was really good seeing how well-being in all its forms connects to what we do at TAP with gratitude as well. It really made me think that there's a lot more to be discussed regarding well-being, and hopefully we can tie it all together. And I think gratitude's a really good way of doing that.
Excellent. Thank you, Simon. Anybody else who was there? Some of the rest of you may not have been there, but
I was there as well. Can you hear me?
we can, Inga. Yes. Hello. How are you doing?
There
you are. You're suddenly on the screen.
Yeah.
We're quick, you know. You don't get a chance here to kind of sidle off behind a curtain or something.
Yeah. So of course, yoga, amazing. I really enjoyed it.
Thank you, Inga.
And I get some ideas because I'm GP and I am on COF quality improvement, like a lead now for workforce well-being. So this is the reason why I'm here, kind of joined here.
Perfect.
And
whereabouts do you work, Inga?
Putnam Medical Center, Bedford.
That's right. I remember you saying you're in primary care.
Yes, primary care. Yeah. So I like about, well, imposter syndrome, well, everything actually, some ideas on PCOS help, and yeah, it was amazing. Yeah,
Perfect. You. Thank you very much. So the big question is, for those of you that weren't there, the maximum we had during the day, I think, was 21 people. Which, if you think about an institute like as a professional institute with several thousand members, that's kind of, it's a bit concerning that somehow we've not tuned in to help people think that A, it's worthwhile attending it, and B, they can positively contribute or positively take something away from it. So Jade and I were wondering this morning, what should we do about our promotion of well-being in the new year through this group? Yes, we're going to issue our well-being guide again. is there anything that you think we're missing a trick on? Should we be doing more recorded guides for how to do well-being, for example, more turn into a little short course masterclass, something like that? Would that be helpful? Because I'm worried that, you know, we're putting on a major well-being festival. We had some really good speakers yesterday, and somehow the virtual meeting thing is not kind of exciting people as much as it was 3 years ago during the lockdowns and such like. Would anybody like to offer an opinion or some advice?
John, sorry, may I ask, I had trouble getting on to the meeting, onto the call, and I just wonder if you had any others who maybe had trouble. It could be this end.
Don't know, Anita. Could you just try to elaborate what sort of trouble you had? I wonder.
Yeah, just getting on. It said the meeting, it was the wrong meeting number, and I kept trying it and going through. Now it could have been an error on my side, or it might have been something wrong at this side, but I kept trying throughout, and I wasn't able to get on.
Okay, well that's useful to know about. I mean, I'm sorry that you were inconvenienced.
No problem.
Good. Okay. Well, we'll have a look at the technicals behind it and just make absolutely sure that we were right there. What do the rest of you think about what we should be doing as a professional institute about promoting well-being, advising well-being, guiding well-being? Should we continue to try to do just virtual meetings, or is there another means of doing this that you think we might be missing? Yeah, go ahead, Marie. Thank you.
So unfortunately, I was one of those people who tried to get to yesterday's meeting, but things got in the way, really. And I do wonder, you know, well-being is something that we, you know, absolutely we need to promote it, we need to support it. But in the operational pressures, the thing that you are going to release is something headed as well-being. If it's something that's just a pragmatic from mine, if it was headed recruitment or retention of staff through well-being, then that sort of jacks up the priority, because the thing is about a tangible thing about what you're trying to achieve. And in Wales, we've just reissued, well, we're issuing we've just issued a nursing retention plan, but that will also be generic plan, very like the HEE one that was done in England that they sponsored. I think the thing for me, if you are a group such as the IHM, I think for me, probably the way you get it across is a campaign with maybe, you know, if you've got that sort of well-being guide and there's a particular campaign that you want to promote, that will probably get you a higher profile, I would have thought. And then you can have multiple lanes in which you're making that offer. So it could be a festival, you know, and I would say people want to meet in person for well-being. They want to connect human to human. But it could be other things. So it could be, like you said about the mug, and I've not come across that before, so that's great. But tools that people can use, a toolkit, essentially, it is really helpful to use out there. And then if you can brand it well enough, you know, it'll get your name out there as well. Because, you know, I've sort of linked in because some of the web, the sort of web presentations you do, but I'm not sure that I'd actually heard of you before those talks and those. I think you did some breakfast meetings, didn't you, about the superpower type thing, the super hour type thing, and that's what got my attention. So just ideas, really.
Well, that's very helpful, Marie. I mean, I'm a big fan of the Macmillan coffee morning events. And I'm not trying to align ourselves with Macmillan at all. They are a wonderful organization who do incredible stuff. But the idea of a campaign where we enable our members to do a well-being morning, for example, by providing a toolkit of resources and ideas to them and encouraging them to get together and then maybe send us their photos of their well-being morning activity, that might be a really nice and practical way for us to encourage our members to get involved in this well-being activity. So thank you. That's a lovely idea. Anybody else? Any ideas? Do you think that's a good idea? Inga's got her hand up. Go ahead, Inga. Thank you.
I would agree that maybe people sometimes would like to meet in person, but again, it depends. I would agree with that as well. So sometimes it's possible to do meetings both ways. I mean, to have a possibility doing face-to-face to join online as well, so that people could choose which way they prefer to go in. That makes sense. So.
Yeah, well, listen, the difficulty we always have is that there's only a few of us at centre. And for us to get around and try to lead all this stuff in person is next to impossible. So we would need our members to act as the local level leaders of a well-being event, but we could provide the resources and tools to enable them to do that on an appointed day, something like that. I think that's the kind of idea that we're getting here.
Yeah, so it's a good idea.
We are, by the way, planning we are planning another national conference next year by way of an in-person event somewhere. We're just working up the practicalities of that at present. But thank you, Inga. I wonder, Inga, by the way, I'd love to have a chat with you about something completely different to well-being. If you could pop your email in the chat for me, I'd just like to contact you about a specific project that I've got in mind at the moment, and with your primary care background, I think you might be able to help me. Okay, thank you. All right, anybody else got any thoughts, proposals, ideas, opinions, anything of that nature they'd like to throw in?
Yeah, no, I do like the idea of creating both digital content that can help support well-being workforce initiatives within healthcare settings. I think the comment earlier was very useful around leading at times more with recruitment retention type language, which might be more applicable to, say, an HR personnel role. But I also love these kind of, the simultaneous morning well-being morning sessions, sort of mixing up the lives. Sort of, you almost imagine a sort of Wednesday well-being coffee mornings type stuff across the country. But that sounds cool. Like it.
I think we might have a bash at that. I think I kind of like the practicality of that. And maybe we'll have some more breakfast sessions as well. We've kind of gone away from the breakfast power hours, but they were popular, and it means that people can do them before they get into their stride in their proper working day and so on. So maybe that's something for Jade and I to take away. As long as you bring your marmalade on toast with you, then anything goes, I think, doesn't it? I don't mean anything, but you know what I mean. And no night attire, you got to come kind of properly dressed. I just thought I'd throw that in there.
I went on a meeting yesterday afternoon and they admitted they were still in their pajamas.
Outrageous. In the afternoon. Goodness me, Marie. Well, the reason I dress, I have told various people this, the reason I always now put a jacket and tie on, even for online working from home sort of stuff, is that in the early days of the lockdown, I did attend a really quite important meeting, and afterwards realized that I'd done it in a onesie, a camo colored onesie. And I really just had to go and have a bit of a chat with myself in the bathroom mirror about the complete way that I'd let myself go. So this is the result now, so because if I don't do this, I will be in a onesie again. Let's not go there. All right, James, yes, have to go, but we'll work with Simon on TAP's entry to the Wellbeing Guide. Thank you very much, Simon. That's marvelous. All right, well, look, in the in the absence of anything else, shall we leave it at that for today? We will do a Wellbeing Day early next year. We will, as part of that, issue the Wellbeing Guide, and we will provide some wellbeing toolkits available free to download for our members, and we'll just campaign it, as Marie rather brilliantly come up with this idea of a campaign to highlight the fact we're going to have this particular day, which will be the IHSCM's Wellbeing morning. All right. Anybody else got any ideas at all? Well, okay, may I wish you all the most marvelous weekend, assuming that you're not working in your usual roles across health and social care. If you are working this weekend in your role in health and social care, I express my thanks to you for your continued excellence. If any of you'd like to see this week's weekly editorial that I wrote an open letter to the new Secretary of State, Victoria Atkins. If you've not seen it, I have had some quite good feedback from it. So if you've not seen it, you might want to have a look in your weekly emails to the editorial. So that's it. All right. Thank you very much, everybody. Lovely to see you. Have a good one. Bye-bye.